not updated and not patient-specific. This is for general information purposes only. Patients should contact their healthcare provider for individualized advice. Dr. Shaw, please tell us about migraine headache.
So, Bola, migraine is a very common headache syndrome. 1 in 5 women and 1 in 20 male in America will have some type of migraine headache during their lifetime. Migraine happens in people who are genetically predisposed to it, and then they get exposed to the right environmental conditions, and then they have a headache. Typically, my patients describe migraine headaches that they start with some type of visual aura, such as this type of changes in front of their eyes, or there is a C shape, we call it scintillating scotoma, and other things. Everyone does not need to have an aura. Migraine headache can be one side or both the sides of the headache, usually pounding in nature, associated with sensitivity to light and noise or smell. Any type of physical activity can make it worse, usually associated with nausea and vomiting. And there are so many other features. No migraine headache is the same, so every person comes with a different type of headache syndrome. Rather than the quality and severity of the headache, what is associated with the headache and how long and how frequent the spells are usually helps me define whether this is a migraine headache or not.
What causes migraine headaches?
So there are multiple schools of theory what causes migraine headache. Back in the days, the vasomotor migraine headache was the most common theory, such as there are blood vessels which goes to our brain, and we believe that the vasoconstriction, it means spasm of the blood vessel, and vasodilation means blood vessels when they expand, they cause migraine headaches. That's why ergot type of medications help. The other school of thought is neurochemicals, so neurotransmitters inside our brain, such as serotonin, plays a major role in migraine headaches. That's why triptan type of medication works. But the newer school of thought is that there is something called electrical cortical depolarization. It usually starts into the back of our brain in the occipital region where we have our vision, and then it progresses to the rest of the brain. Depends upon what part of the brain has involved. Patients have different type of symptoms. To give you a one-line answer, I believe this is a combination of all the mechanisms we understand about migraine headache.
Thanks for detailed explanation, but what type of lifestyle modification can a patient do to improve their migraine headache?
Actually, a patient can do a lot about preventing their migraine headaches, and it's not a major thing. Medicine is not necessarily the answer to all problems. The key lifestyle modification I usually talk to my patient about is sleep. For example, going to the bed at the same time and waking up at the same time. Getting the life in a very good rhythm helps. Sleep deprivation or sometimes sleeping too much can bring on the migraine headache. The second thing I usually talk to them about is the diet. There are multiple different triggers in the diet that one can avoid. Now, these triggers are different for everyone, so one size doesn't fit all. For example, some patients say that eating frozen pizza or certain type of chocolates or aged cheese brings their migraine headache on. So the best way for you to find out is to keep a headache diary or a headache calendar and try to associate any triggers with the day you had a headache, and that way you will find out what is trigger for you, and if you avoid those triggers, your headache might get better. Other things such as preventing food deprivation, like some people skip meals in the middle of the day and then they get hunger headache, and which turns into a migraine headache. Physical exercise is also very important. People who do regular physical exercise tend to have less migraine headaches.